Good morning, everyone. I'm really happy to be able to be here. I come from CAMH, and my background is I'm a psychologist, and I'm a professor in the Department of Psychiatry at U of T, and I direct a program at CAMH, the Azrieli Center for Adult Neurodevelopmental Disabilities and Mental Health. So my focus primarily is on adults, and it's on mental health. But here I am, and I'm talking about transition, and I'm guessing that many of the people here have children who are not yet adults. So here's my disclosure. What you're asking me to do, in a sense, is talk about the future. And I've kind of come from the future, and I'm stepping in to say, okay, here's what you need to think about. But there's a super important limitation. I was thinking about this again last night, and I actually added this slide in because I thought everything I know. So I do some work, for example, looking at healthcare for individuals with neurodevelopmental disabilities from age 18, 20 to 65. But someone who is 65 or even 45 or even 30 right now grew up in a very different set of circumstances than your sons and daughters. So I think it's really important to keep that in mind. And I've actually chosen not to talk about all the research we're doing in terms of adulthood and adult healthcare, because I think we have to understand that limitation. And I think there's many different things that are emerging and changing every year. And so the path that will happen and what's going to happen in terms of transition is something actually I can't predict. But I'm going to try to pull out a few maybe key ideas with the short period of time I have, and I hope maybe a couple of them will resonate with you. I just want to, I've had many conversations with different people thinking about the issue of transition, and I want to highlight a really important piece. There's a whole sort of magazine that came out through the Ontario Hospital Association last year looking at different types of transitions. And a friend and colleague of mine, Crystal Chin, and some of you may have heard of her, she's very actively involved with the OBI, talked about her experience as a young adult in terms of transitioning into the adult system. And we sit on a committee together looking at healthcare in Ontario. And I've been very influenced by some of the things she's been telling me, as well as many of the people that are involved in different studies and projects that I'm involved in. So there's a metaphor people have talked about when they think about transition that sounds kind of scary, where they talk about a cliff. And sometimes we hear about the crisis of what happens when people transition and falling off of a cliff. But I prefer to think, well, before I get to that metaphor, I'll give you one more, which is the challenge sometimes when we navigate healthcare compared to child healthcare, which is very family friendly, very family focused, really sort of looking at the needs of the child. Sometimes when someone moves into adulthood with a neurodevelopmental disability, they're a little bit like that fox mixed amongst all the dogs in terms of finding their way and dealing with healthcare. So sometimes these disabilities become quite invisible to a very busy system where everybody's moving in the same direction. So that's one way to think about adult healthcare. And then the other is indeed this bridge. So instead of thinking about what happens after pediatric healthcare as being cliffs that people fall off of, there is somewhere to go, which is adult healthcare. But you need to cross the bridge. It's not always the most stable bridge. And I would really advise, and this is why I think it's important to be working with families, is that this isn't a bridge that anyone should be crossing alone, right? So I think what really makes success transitioning from childhood to adulthood when it comes to healthcare is our different roles that we can give in making that transition. So I'm going to focus on three sort of roles that I think contribute to the transition. So the first area I'm going to focus on is your child, your son or your daughter. And I have one slide sort of summarizing what I think we need to be thinking about around transition, and then I'll just show a few illustrative examples. So one thing I think that everyone needs, and again, I'm talking from the future in adult healthcare, is I think that all children as adults, and all of us really, need to have a skill when it comes to navigating our healthcare. And that's not about our own health, that's about the healthcare system. So what does it mean when you go to a doctor's office for an appointment? What does it mean when you have to go to a hospital for some kind of surgery or an inpatient stay? What does it mean if you're going to the emergency department? What do you expect in that kind of visit? How do you find your way, right? What kind of information are you going to be expected to offer about yourself? And what are you going to expect from the people that you're working with? And I think that even in childhood, in the healthcare involvement that kids are having, we can start to develop these healthcare navigation skills, because ultimately we want people to be as independent as possible when they're navigating. And I guess the other thing, going back to that image of the dogs and the fox amongst all the dogs, is that when an adult presents in healthcare, regardless of what kinds of disabilities or challenges they may have, there's still this expectation in adult healthcare that you navigate on your own, right? Now, we may not agree, and I certainly don't support that, and I'll talk about that, but I think helping to prepare sons and daughters for a system that looks at solo navigation is really important, okay? But we also need to know, in terms of health literacy, that's not so much just about the health system literacy, that's also about your own health, what it means to be healthy, what you understand about yourself and your body and your mind, and how health works, and having a little bit of that knowledge. So that if you're asked a question about yourself, however you may communicate that information, you can. Needing to know what different health procedures are like. And I think many of you are already aware of these things. Sometimes surprise is not the best way to include how we prepare for healthcare. So having that familiarity or awareness with what it is that's going to happen. I think, again, in child-based care, we're pretty good at modifying and helping people feel comfortable with procedures. We don't think about it in adult healthcare in the same way because we kind of assume everybody knows. And sometimes people who have different kinds of disabilities may not know. In fact, many of us don't know, regardless of whether we have a disability or not. So that preparing or understanding for health procedures is important. And being able to advocate yourself. So again, when you have a very young child as the parent, that is your job, to be the voice, to be the advocate. But there's this transition that happens where you're moving so that the person who has the disability themselves can be doing more of that advocating. And that includes saying no. Right? So it sounds maybe a little bit counterintuitive, but part of finding our own voice in healthcare is recognizing what we're comfortable with and what we're not comfortable with. And if we're really not comfortable with something, that it's okay to say no, maybe find a way to become more comfortable with it, but recognizing that having your own voice in healthcare means that people respect your opinions and you're able to voice them. And some people are going to be really good at articulating that with words and others not, and that's again how we support them. But I think that's an important piece. So the last image or idea I want to keep you with is that in adult healthcare, sometimes you have very little amount of time and you have to be able to talk about your healthcare story. But depending on where you're going, the version of the story can vary. So you might have your hardcover or your paperback version. You might have a little Kindle that's on your iPhone or your iPad. And you might have what we used to call the Coles Notes or the graphic novel. So if you go to an emergency department as an example, many families may have fantastic binders with all of their healthcare information. I do a lot of research in the area of emergency department use, and I work with emergency departments. They're not going to look at that binder. So you need to have that binder, you need all that information. But if you're going to an emergency department, the information you need to present needs to be much more concise. So what's that version of the healthcare story that your son or daughter can tell for themselves? Okay, so different ways to prepare people depending on the context they're in is going to be really, really important. And the first, second, third edition is kind of commenting on the fact that sometimes we just get used to the fact that we have our healthcare information, but it's always changing. And so we need to make sure that sons and daughters are aware of and updating their healthcare information and the way they present their story based on how things are changing. Here's just a nice example of sort of a campaign that we developed through a program I direct called H-Card, where young people are really thinking about both what some of their healthcare needs are and being able to voice even when healthcare has gone a little bit wrong or how it's gone right, but also recognizing what is sort of really important about them as people. It's the most important thing to be known to the healthcare providers. And then here, if you go to our website, and I'll show it again at the end, hcard.ca, we have different kinds of tools that help people, depending on what kind of disability they have and how they communicate their needs, about what kind of healthcare they want to be receiving, and also how to prepare for different procedures. So on the sidebar there, you see some videos. In one video, Francia is talking about how she gets blood work done and how she prepares for that. And then Andrew talks about having an annual health check or having a health exam and how he goes through that procedure. So again, I think we have many of these things in our child world, but sometimes they're focused on the family, or we're seeing kids talking about preparing for procedures. And it's important when we're turning into adults, we want to see adults talking about these things, and we want it to be from the person's voice and not just from the family's voice. Here's another example of a way we would communicate why I'm going to this appointment, what's most important to know about my situation today, but also what's important to know in terms of how you can help me, and maybe issues or things to be aware of to make my healthcare visit go better. Now again, you might have other versions of forms like this already, but this is very person-centric, so it's giving the voice and the power to the person who's coming into that healthcare situation as opposed to you as the parent. And again, these can all be found on our HCARD site. I'll show a few different kinds of examples of things because I don't want to suggest that one example is the only example, but it's just to give you ideas of how to think about different ways to help your sons and daughters advocate for their own care. So here I just want to highlight, and this is the area of autism. The Medical Alert Autism program doesn't have to be very specific to autism. They just sort of announced the autism version last winter. But they've sort of gone beyond just sort of saying, here's a bracelet, but it's here's a bracelet, here's something you can put on your shoe, here's something you can put around your neck. There's no sort of financial, if you can't afford to pay for something like this, then they can accommodate you in that way. But it's something that the whole healthcare system might recognize. And that's really important. Again, I think you're used to in the child world, maybe having a lot of attention around, your family and maybe the disability that your child may have. But in the adult world, we're looking for what is it that people just recognize or think of when it comes to healthcare. And many people are aware of something like a medical alert bracelet, and it reminds them that they need to look up more information. So this is in terms of what you can put into the computer system in terms of really important health information, but also ways to communicate best, that kind of thing, is something that is in a program like that. And then the Aspire program has developed something again in the area of autism, but it's very patient focused. And if you go onto that website, you can see a number of different types of tools and things for adults that were developed by autistic adults for autistic adults to help them in managing their health care. I really like this initiative from the UK, and it's really about knowing you're normal. And again, it's started, or its roots are around young adults with autism, but I think it actually applies to many, many of us. And it's just this concept that to have people be able to help you with your health care, you have to know what is normal for you. And what is normal for you may not be what is normal for somebody else, right? So just looking at me at this moment and saying, oh, that's very different than how other people behave, that must be a problem. That doesn't really make sense. It's more important to be able to articulate, this is what I'm like usually, this is why I'm like now, and this is how it's different. Some people can verbalize that. Some people can show that through photos, through video, right? But helping to support young people as they're transitioning into adulthood to be able to talk about what is normal or to be able to show what is normal for them. Okay, switching now to talk about you as a parent. Again, one simple slide and a couple of examples. I think the model of healthcare, and I've hinted at this when I showed the image of the bridge, when I showed the dogs with the fox, it is a different model. So if we're thinking about just generic healthcare, whether it's going to a hospital, working with a primary care provider for families who are going to be switching from working with a pediatrician to working with a family doctor, things do work differently because in adult healthcare, we're trained to focus on the patient and work with the patient, and it's less focused on the family. Okay? So it's a bit of an adjustment, I think, for parents. And your role becomes more of a sort of quiet support in the background, but an ever-present one. Okay, so I think that you're used to in child-based care being very much part of the conversation and presenting what's going on, but there's this gradual change where you become less involved. And if you have the same healthcare provider over time, you kind of always feel involved. But if you're transitioning to different healthcare providers, or if it's a one-off where you have an appointment with a specialist, they're not going to be thinking about how do we include families in that process in the same way. I think it's important to recognize there are certain types of issues that emerge in adulthood that may not be as present when kids are younger. So I guess the two areas I'm thinking about from some of our population-based research where we've looked at adults generally in terms of how they're using healthcare is we do see more emergency department visits that come up. And we also see more issues around mental health that come up as kids transition into adulthood. So that means there's also different types of healthcare settings that you may be visiting. So it's important to kind of be aware of how those healthcare settings work, what the language is like that's a bit different, that kind of thing. And really planning, I think, for the future is important. And planning is about not just planning for healthcare, but planning for sort of life in adulthood. And as someone who grew up in a family where someone had a developmental disability, I can certainly relate to or understand how difficult it is sometimes to be planning for the future because you're very busy, very present, dealing on what's going on right now. But I think when we think about transition, instead of just being completely afraid and overwhelmed by it, there's a few strategic things you can do to help with that preparing that are really important. So going back to this idea of the health story, having different volumes, different versions, you need to have those in your back pocket as well as trying to support your son or daughter with that kind of thing. And I guess the last point I want to make is how important it is for you across the lifespan as parents, but particularly as children age into adulthood, especially when some of the services may not be there as much as you would like, be thinking about your own support of the parents. So I've used the metaphor before of thinking of parents as cars, and cars age. And as a car ages, it needs a lot of different kinds of repairs and things that maybe it doesn't need when it's brand new. I think it's the same for us as parents. In the beginning of the parenting journey, we have a lot of energy, but I think after parenting for many years, there's a lot of wear and tear that's happened. So paying attention to your own health and the support that you need in your role as a parent becomes increasingly important. So I like this visual of Mary Poppins because she's prepared. And she has this awesome bag that always seems to have whatever she needs coming out of it. And I think we all need bags like that. And then the pay attention part is really noticing, again, so much of what we see in adult healthcare, it doesn't just start out of nowhere, right? So if you're paying attention and noticing whether your son or daughter is great at describing it themselves or not, but if you're aware and you're noticing, you're knowing the normal, you're seeing the difference, you're paying attention, then you can try to get help for things that are small, which is much easier to address than when it's crisis. So I debated about this slide and putting it up or not. It does not apply to all types of services, but it's just a reminder that there are many kinds of services that are out there in adulthood for people who live in Ontario with different kinds of disabilities. It's worthwhile to know that they exist, to be having discussions when you're doing your planning with your schools, for example, when you're talking with your pediatrician or with your family doctor. ODSP is a program for all adults who are over the age of 18. And then for people who qualify, there's the Developmental Services Ontario, which is a process that can begin at age 16, but services are for after age 18. Here's my little image, a reminder again about what is so important for families in terms of taking care of themselves. And it was refreshing to hear the discussion that occurred at the Con Family Day last year around the benefits of meditation. Clearly there are benefits, I think, for children, but there are also benefits for parents. So this was a study that we did with parents whose children were reaching adulthood and they were waiting for services through the DSO. And we basically randomized them, and you're all very aware now of what happens with a clinical trial. We randomized them to a support and information group or a mindfulness group. And what we learned is that parents in both types of groups really benefited from meeting with other parents. They really enjoyed being in these groups where they met other parents. But the parents who reported changes in terms of stress and symptoms of depression were the parents who took part in the mindfulness group. And those changes were maintained over time, but we didn't see those changes in the other groups. I don't think that's the only thing you can do as a parent. I think there's many things you can do as parents, but I think there's value in studying and in learning what works with parents, from parents. So I would encourage parents, both when their kids are kids, but certainly in adulthood, for taking part and contributing to some of that work. That's certainly part of what we're doing at our hospital. So I wanted to spend a few moments talking about the healthcare provider, recognizing that I'm not talking to healthcare providers, and I'll explain what these words mean because they may not make a lot of sense. I think when we're working with healthcare providers in adulthood, you may make a transition to work with healthcare providers who's very comfortable and very ready and accepting for the transition. But sometimes you may be working with healthcare providers who feel a little bit less, I guess, able to do this kind of work. And they say, well, I really haven't worked with a lot of young people with this kind of condition or whatever. I don't feel like I'm an expert in this area. So I think it's helpful to remind healthcare providers, whether it's sort of a primary care provider or a specialist in a particular area, to just kind of say, you know what, you've got this. You have some of these skills already. Sometimes maybe you're looking at my child and you're saying, well, I can't do that because I don't know how to do that. Well, imagine if my child was a child. You'd still be talking to me as a parent, right? You wouldn't just be talking to my child. You'd be looking for different ways to figure out what's going on. Or imagine in terms of accommodations, if I came in here with my child in a wheelchair, there's obviously things you'd be accommodating for that space. Well, my child's not in a wheelchair, but that doesn't mean we don't need accommodations, right? Or many people who work in adult healthcare see a lot of older adults. Okay, so they're very familiar, for example, in the emergency department with screening older adults who've had a fall, who are confused, maybe who have dementia. So again, they may have some of those skills in terms of how to work with someone who's not that articulate or able to talk about what's going on for themselves or needs additional medical screening, but they're not thinking that this person is an aging adult because they don't look like they're aging. Okay, so remembering those other groups they may be more familiar with, but at the same time remembering how different your child is from those groups. Okay, so I think that sort of that combination of helping healthcare providers know that they have many of the skills, and yet there's something also quite unique about your son or your daughter. I think it's really important to invite and encourage that sort of open learning that can happen between the healthcare provider and you as a family. And I think it really needs to be a family-centered team, but just sort of taking that time to help to nurture and develop that. And keeping in mind the same ways you'd be looking for a healthcare provider for yourself, in seeking healthcare providers to support your children as they age into adulthood, you're looking for some of those things in terms of the relationship, in terms of being comfortable with being family-centered, and in terms of being open to learning, because you have a certain expertise, your son or daughter has a certain expertise about who they are and what they need, as does the healthcare provider. So many of you might be familiar with the transition guidelines that were put out by CAPAC, and I'm not going to go over them here, but you can look them up. And these are across different types of disabilities, but key things that should be happening as young people with healthcare needs transition into adulthood. So this comes from the child side of things, because it's the sort of the pediatric healthcare centers. And this is a different set of guidelines that come from the adult side of things. And they're focused on intellectual and developmental disabilities. But again, I think the wisdom in these guidelines are going to be relevant across different types of disabilities. So these are national guidelines that were published in the Canadian Family Physician. So every family physician has these guidelines, and we're in our third iteration. And there's very specific guidelines as well as tools around managing transitions. So the first transition, the one we're talking about now, is from childhood to adulthood in adult care. But there's also other transitions that can happen across adulthood. All of this stuff is available online. You can find these tools, as well as many tools for families around primary care and healthcare in adulthood on the Surrey Place website. So if you just Googled Surrey Place and primary care, you would see these tools and these guidelines. And these are just examples, again, of how maybe we'd be offering information about ourselves as adults and the accommodations that we need when we're seeking our health care when we have a disability that can be helpful. So this is an illustration of how in one hospital, they're actually flagging or noting that the person who's come into the emergency department has a developmental disability. And so there's certain kinds of accommodations or things they need to be doing in terms of their care. And here you're seeing actually I talked about the information we need to bring to the healthcare provider, but it's just as important for us to be thinking about the information that we take from the healthcare provider. So again, I'm not saying that we need to use this exact tool, but I want to highlight here that as an adult, you want to know when you've left a visit, why were you there, and what happened, right? And what is it that you need to do? And so we call this an exit interview. Another example of the tool would be the PODS, Patient Discharge Summary, that is used in many hospitals. But it's a way of making sure we understand what happened in this visit and what comes next. And the language here is important because it's not directed to you as a parent, right? And it's not just something that is a note that goes back to the referring doctor. It's for you as the patient. And that's part of what we're doing in our transition for adults as they're accessing their health care. So the final thoughts I want to leave you with today, I thought, what can I fit into a page in the right size font? So the first one is the importance of investing in relationships with healthcare providers. I'm guessing and I'm hoping that many of you, through your involvement with POND, the fact that you're taking the time to do something like this today, that you're already quite invested in the relationship that you have with healthcare providers in childhood. And there may be some angst about what that means in adulthood. I think we all in adulthood, if we look at our healthcare patterns, especially in young adults, we go to the emergency department, but we don't have a regular checkup. With this population, it's really important to have the regular checkup, to have those regular visits. We have evidence in adulthood that it's very important to keep up the annual health exam, even though in the general population, we're not doing annual health exams anymore. Okay, but that regular familiarity, knowing the family, knowing the individual, knowing small problems when they're emerging is really, really important. The other thing I'm going to add here is the importance of team meetings. They won't just happen automatically in adulthood, but I think they're really critical. So, and I'll give you a very personal example. With my own sister who has a neurodevelopmental disability, we actually meet her family, the people who support her during the day, and the people who are supporting her where she lives at the doctor's office on a regular basis. Right now it's about once every 2 months. And that's with our family doctor. And the reason why we do that is because we didn't do that before. And then all of a sudden we'd have this terrible panicked crisis where everything was going wrong. But when we would start meeting after to resolve the crisis, things would get better again. And then we wouldn't have a problem until we stopped meeting again. So we kind of just invested at a certain point and said, we need to stay up to date with each other. We need to have these meetings at our doctor's office because that's what works for our doctor and that's what keeps her involved in it. And it makes a big difference. So not only may it be important to have an annual health check every year and have that relationship, but to really consider keeping the healthcare provider involved in your team, in your circle for your son or daughter in their adult life. Keep different versions of this book that I mentioned, the short version for the emergency department, the longer version for the specialist. Keep it updated. Remember that mental health is as much a part of healthcare as physical health, and it needs the same level of attention. Keep in mind that you as a caregiver, as a car that is getting a little bit older, requires constant care. You have to care for yourself if you want to provide the best care for your son or your daughter. Knowing that emergencies do happen more frequently for adults with neurodevelopmental disabilities than they do for adults who don't have those disabilities, we can prepare for when those emergencies happen. We may be able to prevent them, but even if we can't prevent them, at least we go in there with the right information and we know what to expect if we're having an emergency visit. And finally, like I said with the crystal ball, being open to the fact that we really are learning about this together with our sons and daughters and with our healthcare providers. What I'm telling you now may not be what you're going to be dealing with when you're at that point, but having that openness to learning and learning how to do things differently, seeing what fails, trying something else is absolutely crucial. So keeping in mind, I think in thinking about all the various complexities that come up and all the things you're managing with your sons or your daughters, that when we have our conversations about them and with them, and even when we think about transition itself, is it a problem to be solved or is it a sunset to be appreciated? And finding that balance where we're making sure with the way we're thinking about these things that they are balanced and we're not just always fixers or problem solvers, but we're really appreciating, I think, what's working well, what's special, and what's unique, and that that's part of our language in terms of how we move forward with our healthcare. So I realize we are behind in the schedule. I'm told we can catch some of it up. I'm here during the break if there's questions. If there's a burning question, I can answer it. Otherwise, I'm happy to chat with people outside because I'm sure you want to stretch your legs. Yeah. Absolutely. Absolutely. Yeah, it's an annual opportunity, and it's an opportunity to kind of practice that skill you're going to be using in other aspects of your life. And maybe just to add to that, the importance of learning healthcare advocacy skills as part of health education and part of that preparation for transitioning out of school. Yeah, absolutely. Yeah. Yeah. I mean, again, unfortunately. Yeah. Yeah, I mean, I think to be fair, so my work is focused more on adults, but in the sort of seeing the future coming from the future, we do try to do in our program to have those interactions with the Ministry of Education. But right now is an opportunity for everyone to be giving their comments. So everyone knows that there's an open sort of comment opportunity through what's happening in terms of health in the schools. Sorry, not health, but just the schools. But you can talk about health and your children's health and what you want in terms of schools, because there is a consultation happening right now provincially around education to give that voice, and then maybe also just to add to what Evdokia spoke about before, that this is a community of people. It cuts across disability. I think everyone putting their voices together around the need for these things in education is important. So there's probably, in CAMH, a focus on mental health with specific groups and kids, but I don't think it's just CAMH that needs to be doing that, and we need to think of how we can work together. Okay. So yeah, one more, and then this will be the last one. Yeah, it's very important. So again, I think both in the primary care Surrey Place website, we talk about pain, and also a little bit on the H-Card website. But that's why, again, know your normal. One of the most important things is how you express. If you have a fever, what does your child look like with a fever? What does your child look like after they've, wounded themselves and there's blood? Because those are the kinds of things we can all relate to, and we would think there would be a certain level of pain. So how do we express our pain? How do we tolerate it? Very important information.